For our patients going home directly from the recovery room, someone will need to drive you home. Staff will review your discharge instructions with you. The nurse will arrange for equipment you may need. While you're in the recovery room, you will be evaluated by the physical or occupational therapist. The therapist will help you practice safe techniques for personal care, walking and transfers, and use of assistive equipment. You may practice on the stairs if appropriate. For our patients staying overnight, the morning after surgery, the physical or occupational therapist will evaluate you. The therapist will help you practice safe techniques for personal care, walking and transfers, and use of assistive equipment. You may practice on the stairs if appropriate. You will be seen by the care manager for discharge planning needs or concerns. Your take-home medications will be sent to the hospital pharmacy in the lobby. We recommend you send a family member to pick up your medications prior to your discharge. Most patients are able to go home directly after discharge. Some patients may transfer to an inpatient rehab facility pending insurance approval. If the physical and occupational therapist recommend an inpatient stay for a patient, the care manager will contact his or her insurance company for authorization. The insurance company must approve a rehab stay and will determine where the patient goes for rehab. Bed availability at the rehab facility is also a factor in where the patient is sent for rehab. The length of stay in a rehab facility varies with the patient's progress. It is usually from 4 to several days long. The therapists, rehab doctor, and case manager will help you with this decision and make the necessary arrangements. Please keep in mind that the majority of our patients do so well that they do not meet the guidelines to qualify for an inpatient rehab unit stay. They're ready to go home. Also keep in mind that insurance companies do not become involved in social issues such as a lack of a caregiver or care for animals. These are issues you will need to address before admission to the hospital.